Every time I come to work, I literally see a miracle. I really do. There are so many miracles that have happened within this hospital, but then specifically within our unit in the NICU. You know, when you sit or when you stand over a baby that barely weighs 1 pound, and that baby's been alive for 3 days, that is a miracle. But at the same time, when you're caring for children, you get much more than that. You get a mother and a father and a grandparent. You get the whole family that is responsible for that child and is vested in their well-being. And so it's really unique that you get to care for not only the patient, but their extended family in the way that you do in a children's hospital. The fact that we are exclusively a children's hospital makes us very unique in that the staff, all the way from the doctors down to the housekeeping department, they choose to be here. They have a certain affinity and a certain care for children. Whatever a patient might need, whatever procedure, whatever testing, whatever surgery, whatever specialist, whatever machine an NICU patient needs, here in our unit, we can provide that.
Things that make our neonatal intensive care unit at Cook Children's unique are several. First thing is we do ECMO. It's called extracorporeal membrane oxygenation. And what that is kind of a huge machine that does heart-lung bypass for babies. And we are the only one in Tarrant County that can do that for babies. So if their heart needs a rest or they have a disease that their lungs need a rest, we can do that for them until the lungs and the heart heal. The other thing that we do is something called nitric oxide therapy, and it's an inhaled gas that helps the blood vessels of the lungs open up so they can oxygenate better. The other thing that we do is hypothermia therapy. So if a baby is born with a hypoxic injury to the brain, if we can get that baby within 3 hours and start cooling the baby, we can minimize that injury to the brain.
And I had a perfect pregnancy, no complications, I didn't have morning sickness, I was very comfortable. It was just a wonderful time. That we had to go to an emergency C-section, and once Jonah came out, that's when they found out how sick he really was. So we've been here a little over a month now, about 4.5 weeks, and through the course of this journey that we've been on, it's just been a roller coaster of emotions. And the doctors have been very straightforward with me. They never sugarcoated anything. They let me know how sick Jonah really was. And I think that was important for me to understand, so that I knew that this whole journey would be a step-by-step, baby step type thing where we would be here for weeks. And I see how well he's doing off of the oxygen, and seeing that his oxygen levels are way high, I have that comfort and that security. And of course the nurses, you know, reiterate how healthy he is and that we're gonna be just fine.
So often the things that we have to say to families are not easy for them to hear, and so I think that being honest with them is a great way that we can show them respect and include them in the care of their child.
We do all the services that a lot of the other NICUs in the area cannot do. In fact, we get a lot of our babies from those NICUs because they don't have the subspecialty services that we have.
There is just something very rewarding about caring for these kids and knowing that all of the interventions that we're doing is sustaining their life. I feel like it has changed my life in that I'm more sensitive. So I hope that I have affected patients and families' lives by just being an honest person that they can trust, being a nurse that they can take comfort in, and know that whatever their child needs, that I'm going to provide, and provide to the best of my ability.